Hello and welcome to Healthy Living, brought to you by Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about comprehensive breast health. We'll talk with three specialists from this area here in West St. Tammany. Cindy Turner, who's a nurse navigator in the cancer programs of St. Tammany and Ochsner. Melissa Varnado, who's a nurse practitioner with the high-risk breast disease clinic next door to the St. Tammany Health System Women's Pavilion. And Dr. Yasmin Haja, who is a cancer breast disease specialist at St. Tammany Cancer Center, a campus of Ochsner Medical Center. So we'll start first with Cindy Turner. Cindy, thank you for joining us.
Thank you for having me.
Really excited to have you here. You have, decades of experience at the Women's Pavilion, and you are now nurse navigator for patients who are finding their way through that cancer process. So let's talk a little bit about the Women's Pavilion. I mean, it's a breast imaging center of excellence. It's one of only five in the state that are accredited. So it has some badges of honor, but I think more importantly, that's a first step in the continuum. And we like to say for women, but if we're honest, patients, because women and men can face breast cancer diagnosis.
Absolutely.
Can you start us out at the beginning there and walk us through a little bit?
Absolutely. So it's true, we do see men and women at the Women's Pavilion. And the starting point for most women with mammography is with a screening mammogram. And generally that starts around the age of 40, unless there's a strong family history, and then that can be kind of adjusted. But the typical woman would start with mammography around age 40. It's something that we believe should be done yearly, as long as they're in good health and they and their physician agree on that. A screening mammogram is a very low dose radiation test. It's done for women who are not experiencing any kind of breast problem. So the screening is just some standard views that they perform at our facility. Usually the results are read within a few days. And what it's looking for is trying to see if there's any abnormalities maybe that they were not aware of. The difference between a screening and a diagnostic mammogram, which is another type of mammogram we do, is for someone who is experiencing a breast problem. So for instance, if they had an issue like a lump or pain or something like that. But a screening is something that we do recommend that they do yearly in conjunction with their doctor's clinical exam.
Okay, so, and you actually brought up something that I wanted to think about and talk about, because you're right, early detection, screening mammograms, that's a personal responsibility. Each of us needs to just make ourselves go. And the Women's Pavilion is a beautiful spa-like atmosphere to make that 15 or 20 minutes of quick screening.
Right.
A pleasant experience and a good experience for all of the patients who need to have it done.
Absolutely.
And in that spa-like environment, we have, beyond the screening mammogram, what you mentioned, there are some really in-depth diagnostic tools and some specialists.
That's right.
So that if something is found in that screening mammogram,
Yes.
or if a patient and their doctor have found something suspicious or concerning,
Right.
then we can move into those diagnostic tests.
Right.
And so aside from diagnostic mammography, can you talk a little bit about what else is at the Women's Pavilion in that regard?
Yes. So if a woman has to come back in for something they found on the mammogram, they might be called back for that additional, more specialized mammogram, which we call a diagnostic mammogram, or a breast ultrasound. And those are two tests that will be done kind of simultaneously. The radiologist will come in and explain the results to the patient while they're there, to try to figure out, is this something that's just a benign condition that we can watch and sort of watch it for a period of time until it's stable, or is it something that's more concerning that we might need to progress to a biopsy for instance, which we do there at the Women's Pavilion. And we have a couple of different modalities that can be done through special mammogram type of biopsy or an ultrasound guided biopsy. And we do have breast fellowship trained radiologists who are actually reading those and interpreting those test results right then and there with the patient and trying to explain them fully so that they can kind of ease their mind of what is happening to them. There's also, coming to the Women's Pavilion soon will be on-site breast MRI. At this point in time, we do it at another location, but our radiologists, our breast-trained radiologists are actually the ones that read those tests as well.
Wow, okay, so we have screening mammography that helps us with early detection, gives people the peace of mind of knowing everything's healthy, everything's fine, or in the case of a finding, leads them into a process that you as a navigator can help them to find that way forward. And that may mean a follow-up mammogram, which is a diagnostic mammogram.
Right.
Or it might mean ultrasound, it might mean ultrasound-guided biopsy, it might mean mammography-guided biopsy.
Right.
And it also might be breast MRI.
Yes.
And all of those capabilities are within St. Tammany Health System in Oxnard through the Women's Pavilion or the hospital or the Cancer Center.
That's right.
And the breast-trained, the fellowship-trained breast specialists in radiology
That's right.
are working there full-time at the Women's Pavilion to read those tests, to look at those images,
That's right.
and to help with the diagnosis. And that helps you as a navigator help this patient work their way through that process.
Absolutely.
Well, that is wonderful.
It's great.
So I'm thinking about, you know, we talked about the spa-like atmosphere of the Women's Pavilion and how pleasant it is. And that is sort of the hurdle there, is getting patients to choose to come in and get
Right.
that screening mammogram done.
Right.
And so there is some outreach into the community that we can talk about, and that is something called the Be Well Bus.
Yes.
And that's St. Tammany Health System, through a federal grant, was able to purchase this mobile health unit. And
Yes.
one of the most specialized things that the unit does is mammography.
Right.
And so that's a partnership with the bus and the Women's Pavilion, because we need those mammography techs
Yes.
to be a part of the team when we're out doing
Absolutely.
mammography in the field. Can you talk a little bit about what it means to really get out there in the field and bring that level of care out to the
Yes.
community?
Yeah, I'm really excited that we are part of this program. I had the chance to tour the bus at a recent event we had there, and it's a beautiful facility. It's really state-of-the-art. The mammography that you receive in that bus is just like the mammography you would receive in the building. It's an opportunity for women, I guess, who may not have insurance or may not have the ability, or even if they do have insurance, but it's bringing that opportunity to them. It's, as women and men, I'm sure, but women especially have a hard time trying to balance getting their own health care done compared with working, taking care of their family. So sometimes it just escapes them and they don't think about it. So being able to be present in the community and having it in front of them, I think is a huge asset. And the technologists that are operating the mammography in the bus are top-notch. We have amazing technologists at the Women's Pavilion, both with mammography and ultrasound. They're very highly trained, and they work very well with our radiologists. So I feel like the quality that they're getting in the Be Well bus is top tier. So I feel like it's a blessing to our community.
That is really something. Cindy, thank you for telling me that. So inside the bus, you have 3D mammography. And inside the Women's Pavilion, you have 3D mammography, and you have those highly trained, specialized technologists who know what they're doing and do this all day, every day.
Right.
And when they're on the bus, it's almost like a field trip. They get to go do what they do out in the
Yes.
field.
I know. I'm
That's
a little
pretty
jealous.
exciting.
It's great.
And I think it's good too, because as you mentioned, sometimes it's a time factor, but I think also that bus can go to areas that are further away from Covington. And so for people that the travel into Covington may be burdensome, or getting off of work can be an issue, if we can bring that bus into a parking lot in Folsom, for example, or Madisonville, or out in Lacombe, then we are able to bring the excellence of the Women's Pavilion diagnostics screenings out into the field.
Right, and that's a huge benefit. We have a lot of rural, communities here that I think really benefit from that.
Beautiful. Well, Cindy, thank you so much for coming in to talk to us about breast cancer, about the Women's Pavilion, and the Be Well bus.
Absolutely. Thank you.
Happy to have you. You're watching Healthy Living, brought to you by St. Tammany Health System, and we'll be right back.
Here on the North Shore, along these halls, There are many minds at work. At St. Tammany Health System, many innovations happening now, and even more on the horizon. Many reasons we're number one.
Welcome back to Healthy Living. We're talking today about comprehensive breast health. We heard from Cindy Turner, who is a nurse navigator with St. Tammany Health System, and we're talking next with Melissa Varnado, who is a nurse practitioner in the high-risk breast disease clinic of St. Tammany Health System. Melissa, welcome to the show.
I'm so happy to be here.
We're really excited you're here. And the high-risk breast disease clinic is really a unique aspect that St. Tammany Health System introduced a few years ago. And when you think about that continuum, Cindy and I were talking early detection, we were talking about some of the diagnostic tools at the Women's Pavilion, but there are so many decisions that need to be made and so much that breast cancer patients have to consider and sort out and move forward. And you as a nurse practitioner in the high-risk clinic really have a role to help people through that.
And I love that role. It's a good catch-all. It is once they have a screening mammogram that goes to diagnostic, sometimes they have some questions. I'm able, if they can reach me, as they can reach Miss Cindy. And it's we're a touch point for them. And then we kind of work through the diagnosis. And as soon as we know it's cancer, we get them in the clinic within a day or two, and we meet with Dr. Bonagera, we get a plan, we reach out to a medical oncologist, radiation oncologist, and everybody gets together. We have multidisciplinary meetings where everybody sits at the table and we all have a group discussion and get a plan what's best for our patients. So it is a piece of a larger puzzle, but it's the best specialists for our patients. They get the care that they need.
That's fascinating. And to me, you said multidisciplinary, and that is something that I think really makes that high-risk clinic and our entire system not unique, because obviously multidisciplinary teams are the future of cancer care, but it's right here in Covington.
It is.
And that multidisciplinary approach that you're talking about, you have those diagnostic perspectives from radiology, and you have those curative modalities. So you're hearing from someone who knows chemotherapy, and someone who knows radiation, and someone who knows surgery. And so each of those are looking at cases. And the other thing that I wanted you to talk about, it's not that they're talking in general about a case or cases, they're talking about this patient.
Absolutely. It's
and
individualized
these
care.
exams. So kind of walk through that.
So the perfect, it's just a kind of a perfect storm. We got the best in every field. We get together, we talk about individualized care, and we're able to deliver it the St. Tammany way at the bedside, at the clinic. We are your friends, we're your family, we see you in the grocery store. So you have the access to all these specialists that are renowned in their field, but the delivery is hometown. You know, you're not a part of a larger system, you're just a part of the family, and we'll take care of you. And even years after your diagnosis, when it's just a part of your medical history, we still take care of you, we still follow you. So you never leave us. So from, as I said, from diagnosis to care delivery to survivorship, we're here for you.
That's wonderful. I'm just envisioning that, because you think about as a healthy person who, let's go ahead and admit, I'm north of 50. So yes, I get my mammograms.
Good.
And I go to the Women's Pavilion because I love that spa.
Yes.
And each year I just go and I think, all right, I just need to get this done, and I'm done. But there is that moment, there is that time that a patient can have that callback. So I'm checking my chart and it says, yep, everything's fine.
Yes.
But I could be checking my chart and get, everything's not fine and we need to talk to you.
And the good news is at the Women's Pavilion, usually you don't get the report on your screen. You get it face to face. This is what we have. This is what we think we have. This is what we have to do about it. This is our plan. So it's not the, but what if? And you don't have, and you don't go through this process alone at all. It is definitely physician-guided care. It is, I'm here, the breast nurses are here. You always have an access to the clinic. You always have access to your provider, which is wonderful. but you don't have that diagnosis, it's not alone, it's not technical, it is personalized care.
I love that. You know, I was talking about my chart, and I love my chart
It's
because
very good,
it's
right.
so useful.
Yes.
As a matter of fact, the newest thing in breast care in my chart is that you can schedule your own screening mammogram.
Yes.
Which I'm just thrilled about, because you know it's nice to call the Women's Pavilion when they're open, talk
Yeah.
with someone, get it set up. But if they're not
ease
open,
of access, right?
You know, if it's 10 o'clock at night when I go, oh, I didn't call today.
Yeah, but it's fine. We're here.
That's
So-
perfect.
And we have a great event in October. So it doesn't have to be because it always is. It's I have to go do this, because let's face it, nobody looks forward to their mammogram, and there's a lot of anxiety there. But in October we have a wonderful party, and we had food trucks, we had champagne, and it made it a pleasant experience with a Be Well bus. So it's an event you look forward to, especially because October is our Breast Cancer Awareness Month. So the Women's Pavilion is very, very, I'd say, motivated to make it a positive experience, and for something we don't dread every year, because it is so very important, especially for the women that have mothers that have breast cancer, aunts that have breast cancer, because that makes them higher risk. And that's why I'm there. We discuss the risk. Is it their family risk? Is it their genetic risk? And do they just have a breast density risk? If you're higher in breast density, then it automatically makes you a higher risk for breast cancer. So we kind of go through the factors that make them high risk. What do we do about it? Do we do surveillance? Do we talk about risk-reducing mastectomies? There's lots of options there. And I tell everybody, my job is just not to make the decision for you, to make you the most educated, give you the most education so you can be a good advocate for your own healthcare, and that will make you strong to make your own decision. So it's just giving them the information, letting them make the decision that's best for you and your family.
I'm just trying to process all those things. That's amazing. So in the high-risk clinic, you're just talking about what makes a patient high risk.
Correct.
And so, you know, I think that we generally hear about people who have a genetic predisposition toward cancer. So if your mom had breast cancer, and her sister, your aunt, had breast cancer, and their mother, your grandmother, had breast cancer, that's enough that you're kind of at high risk.
Right.
And so maybe there are more surveillance tools.
Certainly.
Or maybe we want to be much better about those screening mammograms.
Yes. And twice a year would be ideal if you're indeed high risk. But we're very good at having our GYNs and our family practice doctors or physicians or mid-levels see, once they get those yearly mammograms, if they do a scoring at the bottom, if they consider their score high, to refer to us. So my first question is, when our ladies sit down, or our men sit down and say, do you know why you have this appointment? And then we'll go through everything, all the factors that kind of made them a higher risk patient. And then knowing their number, what are we going to do about it? Are we going to do twice a year screenings? And it's just kind of it's preventative medicine. And if your risk factor is high enough, do we need to talk about risk-reducing mastectomies? So if 100 women walk in and they all have breast cancer, 10 of them have it because it's genetics. A lot of people think it's genetics is the larger part. It's not, because Angelina Jolie, her mama had the breast cancer mutation. She had the mutation. That's why she had her risk-reducing mastectomies. So that got a lot of information out in the public. But so everybody thinks that it's all genetic, but it's not. It's just a tiny part. 10 to 20% of those women have familiar cancers, like you were talking about. The aunt, the mom, the grandmother. But they didn't have a genetic link. It's still familiar. And then 70 to 80%, which is the scary part, is sporadic.
Wow.
So these are the ladies that had their screen and mammo, like you do every year, and got a call back or got to have a sit down and said, hey, look, there's something we're concerned about. So that's why it's so important, because genetics is a piece of the puzzle, but it's certainly not the complete picture.
Right. And so if we're someone whose mom, aunt, grandma didn't have it, we don't want to just go, I'm in the clear.
Right.
We still want to have that screening every year.
Absolutely.
And we want to come back, and if we wind up at the high-risk breast clinic, we'll be meeting Melissa Varnado.
Yes, you will. But we try to the whole visit is to reduce anxiety, and and we have such great tools. We have Dr. Torwick at Ochsner, and he helps with our patients with anxiety. So we have the Cancer Center, the St. Tammany Ochsner Cancer Center that has integrative oncology there. So we have lots of good resources there to reduce some of the fear, some of the anxiety.
Fantastic. Well, Melissa, thank you so much for coming in to talk to us. I really learned a lot today, and I think our viewers did too.
Thank you for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about comprehensive breast health. And we'll be right back.
We know there are many benefits to living on the North Shore, like world-class ortho care at St. Tammany Health System. Many reasons we're number one.
Welcome back to Healthy Living. I'm your host, Melissa Hodgson, and we're talking today about St. Tammany Health System and Ochsner Health and the cancer services available for breast cancer here on the North Shore. We spoke with Cindy Turner, nurse navigator, and Melissa Varnado, nurse practitioner. They talked about early detection, about some of the diagnostic tools available in finding and fighting breast cancer. And next, we're going to talk with Dr. Yasmin Haja. She's a breast specialist working at St. Tammany Cancer Center, a campus of Ochsner Medical Center. Dr. Haja, welcome.
Hi.
Thanks for coming into the show.
Thank you. Thank you.
I guess maybe talk first a little bit about yourself. Tell us about your background.
So I'm originally from Middle East, from Jordan, and I've been here almost 10 years. I moved to Louisiana. I did my residency in Baton Rouge and my fellowship in Tulane.
Wonderful. And your area of interest and your area of specialty here is breast cancer.
So, yes.
And so, as I was saying, we kind of talked a little bit about how patients find out that they have breast cancer, how we in our system are able to help them understand what's available to them. But there's something really special going on at the corner of Tyler, Ochsner, and I-12.
Yes, it
And
is.
that is St. Tammany Cancer Center, a campus of Ochsner Medical Center.
Yes.
Talk a little bit about what's so special there.
So I feel like that when we had this partnership between Ochsner and Tammany with the new cancer center, we were able to increase our ability to provide the best care for our patients in the North Shore. We have this multidisciplinary breast cancer, or what we call multi-D. We have their exceptional team full of ability to provide to the patient with the best quality of care. We gave them impeccable treatment. Our team has medical breast oncologist, myself, a radiation oncologist, and a dedicated breast surgeon.
Wow. And of course, surgery isn't performed at the cancer center, that's at the hospital.
Yes.
But really, when you think about everything that's available throughout the Covington area, from the Be Well bus in the Women's Pavilion, doing those early detection, and then even at the Women's Pavilion, those highly specialized diagnostics, and then that high-risk clinic helping patients to navigate their way through. And then you have St. Tammany Cancer Center and St. Tammany Health System where surgery is going on, but you're talking about bringing that surgeon down to the cancer center.
Exactly.
That actually, in addition to the work that you do in medical oncology and your colleagues in radiation oncology, that surgeon is present and seeing those patients post-surgery, and you all are doing that multidisciplinary consult to talk about an individual case.
Yes.
And you do that there at the cancer center.
Yes, so the patient comes and sees all of us in one place at the same time.
And to me, that's fascinating. Because if
Exactly.
you think about it, from the time you first find out there's something going on, then if the first available appointment is weeks away, then you talk with that medical oncologist, and then a couple of weeks later you can talk with a radiation oncologist somewhere else, and then a couple of weeks later you can talk with a surgeon somewhere else. And then you've got to go home and sit at your kitchen table and sort that information out alone. That can be really overwhelming.
Exactly.
And so by putting all of these specialists together in this beautiful environment at the Cancer Center, you're able to have someone come in and work through that progression and think about those different treatment options
Yep.
with some help from a navigator.
Yes.
And then I think one of the other things that's really fascinating about the Cancer Center is the emotional, social, spiritual component in integrative oncology. Can you talk a little bit from your perspective as a scientist, as a clinician, what that brings to the table?
So, I mean, having a new diagnosis of a cancer, and especially breast cancer, it's not an easy thing to go through. And I feel it's my pleasure sometimes to treat those patients, holding hands and discuss with them and go in every single detail. It's a pleasure, honestly. So when we see the patient together, we discuss the plan, we go over every single detail from imaging, radiation, pathology, and if the patient needs social support, need any psychology, we do have in our cancer center a psychology Dr. Tork, and he can help us with everything, and if we need anything from the patient, we can send him up with him and he sees them as an outpatient. Yeah, so I feel emotional support is very important and is one of the best things that proved to help the quality and the mortality and the morbidity of the patients if they're supported emotionally by us. Yeah.
Can you share why you chose to go into your area of specialty? That's fascinating to me.
Well, I've always dreamed to help. I'm always help people. I like to. And it's part of my natural personality. Since I was high school, I always keep telling my parents that I want to find the cure of cancer.
Oh,
yeah,
that's
and I wanna help
wonderful.
them. Yes,
Well,
I'll always dream about that.
I think that's fantastic. And then you find yourself specializing more and more. As a child, you say, I want to be a doctor.
Yes.
And then as you get older, you start to realize, I want to be a doctor who's going to make a difference in cancer. I want to cure cancer. And then you begin to realize that cancer is an awfully complicated animal.
Very
So
complicated.
you find your way through that. And you did training in Jordan and in the United States.
Yes. Yeah.
And talk a little bit about your choice to come to South Louisiana.
So I married my husband. I met my husband back in Jordan. He's born and raised in Louisiana, in New Orleans, and we met. We fell in love, and we came all the way from Jordan here. That was pretty much why. But then when I got into the culture of people and the music, the food, the hospitality of the people in the South, it's just amazing. It reminded me of my hometown, to be honest. And I just loved it. Since then, I've been here for almost 10 years, and I feel like I'm home.
That's wonderful.
Yeah.
And it has enabled you to hone your practice entirely into breast cancer with some of the leading specialists in our South Louisiana area. You mentioned Tulane as your training, which is fantastic.
Yes.
And you've now been with Ochsner and St. Tammany and working with all of those specialists in the Cancer Center. And so I think it's interesting to me when we think about the Cancer Center and about how folks are coming into, by the time they're coming to the Cancer Center, they have their diagnosis, they have some semblance of a treatment plan, possibly they've even already done surgery and other things like that, depending on their course of care. And so they're coming into that Cancer Center with a little bit of knowledge and a lot of fear.
Yes.
And so I think the flow of the place is designed to put people at ease. And so can you talk a little bit about how you work in the Cancer Center with others in that team environment?
So basically the patient comes in the morning or in the afternoon, depends on the appointment, and then he sees me, the surgery, the radiation oncology, and then we come together, we discuss the patient's plan, we go through every little details of their imaging, pathology, radiation, guidelines, everything. And then we come back and do this comprehensive plan and discuss it with the patient. We discuss every little detail with them, and then afterwards, our best goal is to have the patient leave the cancer center with the peace of mind and trust and the confidence that he has a solid plan and that all of his providers are on the same page.
That's fantastic. I love that. You've just kind of walked us through exactly why that Cancer Center is where it is and why we built what we built. And you, I think, are a wonderful representation of the specialized cancer specialists that we have chosen to coalesce together in the Cancer Center with our partner Ochsner. So thank you so much for coming in.
Thank you so much. The pleasure is mine. Thank you for having me.
Indeed. You've been watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we talked today about comprehensive breast cancer care and all of the resources that are available to people who live on the North Shore here in West St. Tammany in the Covington and surrounding areas. Thank you so much for joining us. We'll see you next time on Healthy Living.